Good evening. Welcome to the America's Heroes Group Roundtable live stream digital media show. I'm your host, U.S. Army Iraq combat medic and flight surgeon, Colonel Dr. Damon Arnold. We have a special guest with us, a panelist from the Kaiser Family Foundation Health News, Rebecca Grapevine. I was so impressed when I was reading her history of the things that she has done. And I have to actually ask you about a couple of things that you've done. But Rebecca was born and raised in Atlanta, Georgia. She got her start as a journalist writing for the Georgia Health News and KFF Health News. She has also reported for the Atlanta Business Chronicle, Capitol Beat News Service, and the Louisville Courier Journal. Along the way, Rebecca earned a PhD in history from the University of Michigan and learned to speak Hindi, and she says nearly fluently. And that's an incredible accomplishment. I have no idea how you accomplished that at all. But so today we're going to have a great discussion. Biden's rule cleared hurdles to life-saving HIV drug, but in Georgia, barriers remain. And she wrote this article in the Healthbeat on February 6, 2025, which is part of the KFF Health News. So welcome, Rebecca. Already in awe of your accomplishments.
Thank you so much. It's great to be here.
Great. Yeah, because there was one thing you were writing about was the pre-exposure prophylaxis that reduces the risk of new HIV infections through sex by 99% and among injectable users by at least 74%, according to the Center for Disease Control and Prevention. And you would think that if this drug were that powerful, everyone would have access to it. But what you're telling me in the articles that people don't.
That's exactly right. You know, I got started on this article when I attended a conference here in Atlanta, sponsored by the Southern AIDS Coalition. And people were discussing PrEP a lot. I kept hearing PrEP. So first I had to stop and think, okay, what is that? Like you said, pre-exposure prophylaxis, or a drug that can help prevent HIV infections. And then I had to kind of really stop and think, okay, now what does that mean for my community where I live, which is Atlanta, that I report on? And that's how I got started working on this article, was just trying to understand, first of all, what is PrEP? Why is it important? Why is everyone talking about it? And then two, what does that look like here?
Okay. Yeah, because you also had mentioned that cost was one of the barriers, but that's no longer really the case. There's some other factors that are sort of creeping into the picture, and that President Biden's administration last fall issued guidance requiring most insurers to cover the full cost of all forms of PrEP without prior authorization, along with certain lab work and other services. But it seems like these are still not being effectuated within communities equally.
Yes, I mean, there is, has been a long conversation and, advocacy effort around the cost and insurance coverage for this drug, again, PrEP, that can help prevent HIV infections and, in other forms is used to treat HIV infections. So there have been questions raised, and insurance companies had reportedly been not always covering PrEP in all its forms for certain patients. And so advocates said, hey, insurers, we'd like for you to really step up and follow the tenets of the Affordable Care Act. This is a preventive service, PrEP. It's designed to prevent HIV and do a better job of covering this drug. And the Biden administration, enacted or put into place this guidance this past fall. It's a little bit tricky how it gets started and the date that it starts, but for people whose new insurance plans started on January 1st, there's a good chance that this rule would apply to them, without getting into the super weeds on the insurance side of things.
Oh, right. Yeah, because back on January 27th of this year, the Trump administration entered an executive order that seems to have rescinded or put a funding freeze, reversing Biden's order. And I know that things like the Ryan White HIV/AIDS program and HIV prevention funding seem to be affected by this. I was a former director for the Illinois Department of Public Health from 2007 to 11, so I'm very familiar with the Ryan White Act and how it actually saved so many different lives. But what do you think this is? Because you were saying that Schmidt was one of the people that you were talking to, and said that he does not think the Trump administration will repeal the rule, but he is concerned about the U.S. Supreme Court and for preventive services. So tell me a little bit about that.
Okay, well, that's. I'll try to keep it simple. So feel free to stop me at any time or ask questions. It's a little bit complicated, but you're right. Carl Schmidt, he's with the HIV and Hepatitis Policy Institute, and he did tell me, this rule that again applies to insurance companies instituted last fall under Biden. He doesn't think it would necessarily be rescinded by the Trump administration. And remember, it applies to insurers, so it's not necessarily having to do with the federal budget and things like that. We can get into that later. But then to your point, he did say, yes, however, what I am concerned about is this big Supreme Court case that a lot of people are looking to be decided this summer. It's had a long and winding road, which I'll let somebody else tell you about. But essentially, Becerra v. Braidwood Management would be undoing some protections for preventative health services. That's the concern among advocates. And so that's what he was talking about. That is a complicated case, but it's something that people can keep their eyes on as we roll into the summer.
Yeah, because so one of the things that was sort of tagged to that a bit was the issue about the Affordable Care Act and how that the expansions in some states on the Medicaid are available, but those actually are threatened as well. And the Affordable Care Act actually expanded some of the coverage on the the Biden plan that was put in place back in August 16th of 2022. So it's been in effect for some time, but the withdrawal of that can actually affect people as well, right?
Right. And just to go back and correct one thing, it's Braidwood Management v. Becerra. That's the case that's coming up this summer. But yes, there are a number of services, that people are concerned about, HIV PrEP services being one of them. Many services, as you said, under the Affordable Care Act that are, included in that preventive services, bucket of care, colonoscopy, mammogram, or some of the other ones I've heard advocates mention. So that is definitely, a concern for folks across the healthcare world, I would say, or something that they're looking at, something that they're tracking closely. It is interesting, when it comes to Georgia, to Atlanta, and to other, non-Medicaid expansion states. So far we've been mainly talking about insurance coverage for PrEP. Whether it's through an employer or Medicare or, the Affordable Care Act marketplace plans. But there is a large uninsured population, in many states, but especially in Georgia, there's about 1 million folks, under age 65 who don't have insurance. And so that's a whole separate, challenges of getting access to PrEP for that group of people.
Yeah, this is really a critical issue. One of the things that I remember talking about at length with some of the epidemiologists and the infectious disease people in our state is that actually pre-exposure prophylaxis also protects the mom if she gets pregnant, from transmitting this potentially to a child if she were to get sick with HIV. With the HIV virus. And this is really a critical issue, not only for the mom, but, potentially for the unborn child. And then you had mentioned that Georgia has a big racial PrEP uptake. And there was Patrick Sullivan, you had mentioned, who is a professor of epidemiology at Emory University, who leads the AIDS VU section and pre-exposure prophylaxis VU, which track HIV data and access to the drug. And so, tell us a little bit about that. What you uncovered with that that situation.
Sure. Thanks for that question. And I'll just start out by saying, AIDS View and Prep View are great resources. These are like data tools that can help you, and whether you're in Georgia and Atlanta like I am, or anywhere in the country, look and see a whole host of data factors about HIV and PrEP use in your community. And it's really easy to use too. That's another huge plus point. So you don't have to use spreadsheets. It's a nice map you can use. But looking, diving really deeply into the data there and talking to folks here in Atlanta and other experts, there is a big disparity, especially in this thing scientists talk about called the PrEP to need ratio. And that's how many people ideally would be getting PrEP to prevent, new transmissions of HIV. Kind of the hope compared against the reality of, okay, this is how many transmissions are actually happening. And they you can use, see how states are doing on this. And Georgia does have an overall lower rate at around 6. This ratio is 6, whereas nationally it's more like 13. Then you can zoom in and look at different demographic groups and their access to PrEP or their uptake of PrEP, which we did in the article. You can go, there's a nice pretty chart, but not to get too deep into the numbers, but the disparities are there, especially between Blacks and whites and between women and men. That was the data I looked at for this article.
Okay, yes. Yeah, because the numbers are pretty astounding. From what I was looking at, it's approximately like 9 times more likely to have the PrEP if you are white as opposed to if you're Black or African American, and not much different if you're Hispanic or Latino from those numbers. So it seems like there is, and the national picture is not that much greater. I mean, it's running neck and neck. But I'm wondering if that is because of access, geographically where people are living. You have rural areas, suburban areas, and urban areas, and whether that has to do with wealth distribution. I know the World Health Organization talks about that wealth distribution and the access to care. That's one of the social determinants of health. So there are multiple social determinants of health, but it seems like there was also one of the people you interviewed for it was talking about, transportation and other issues come up as well. But maybe you can go into a little bit about that, about why those other things get in the way.
Sure. And, I'll leave it to epidemiologists to kind of explain how all those factors work together.
Right.
But, at a sort of a statistical level, but I can tell you from speaking to people here in Atlanta, whether that was patients who used PrEP or wanted to use PrEP, or, clinicians who helped provide it, there were a number of factors that came up besides just the cost. And anyone who's ever been to Atlanta can probably relate to the transportation thing. The city is large. There are, even if you have a car, it can take a while to get somewhere depending on factors. And so, there's also public transportation here, but there may be areas that are not so easily accessible. And so, when people are having to travel regularly to get on PrEP, because one thing folks emphasize to me, it's not like you just go, you want to be on PrEP long term and you're taking this pill. There is some lab work and testing that has to go on a regular basis. And so there is a commitment there from the patient to go and get that done, to get the refills, etc. So that can be a real challenge for people. And that's why, a lot of folks too were saying, hey, there's these drugs on the market. They're not pills. We don't have to necessarily take them every day. This is one up and coming, or one, form of PrEP that people would rather take than a daily pill. So we can get into that too as well. But yes, getting access to transportation for these services, where these services are located, in terms of where people live who want to access PrEP, those are both issues.
Yeah, and why do you think there's such a high rate. You have that in Georgia, but it's only second to Washington, D.C., as far as the, new diagnoses that are going on. Do you think it's that communications issue or outreach issue? What's going on within the community to cause that to happen?
Yeah, I think again, that's a complex problem. I mean, I will say this, and I asked different doctors and researchers here, like, let's take a look at a city like maybe San Francisco, where, yes, HIV isn't entirely gone, but the numbers, were really, really low, especially when you compare it to a place like Atlanta. So what would Atlanta have to do to get there? And, they said, well, we do need to increase our PrEP uptake because this
Mm,
prevents new transmissions of the disease. And you have to really sit and think about that. That is a key part. It's not the only part, but it's a key part of ending the HIV epidemic. And that's whether you're looking globally or, you're looking here
mhm.
in Georgia. So a key part of this is making sure that people who potentially would be on, at risk, however that's determined, can access this drug. So I think one doctor even said, Atlanta needs to catch up on that part. That said, there are always going to be, folks that are easier or more difficult to reach. And one doctor, even I spoke to one researcher, even used the term, last mile problem. There are always going to be people who, potentially are tougher to reach. And so how do cities address that problem as well? Um, just
Mhm.
for a plug here, there's a great Nova documentary that I watched when I first started working on this. I
Oh, okay,
think it's
great.
called Ending HIV in America. It's like less than an hour. It was really good, really helpful, but it really helped me understand again why PrEP is so important to the
Mhm.
ending the HIV strategy. It's we have a treatment piece. We can talk about that another day. We need to, treat HIV effectively, advocates say, but we also need to end new infections.
Yes, yes, yes. And so do you think it's part of the, the educational system? Because sometimes with the educational system, in schools, they talk about certain things, but there are, people who are pro and con talking about, sexual education and that kind of thing in school. But is that something that you think, people uh, are lacking that exposure to the knowledge or the information? Uh,
That's a really good question. I mean, I talked to some folks about that. I mean, and there's, again, when we're talking about information about any health issue, but especially HIV, there's a lot of factors to unpack. You know, um, some people said we feel left out, especially as Black women or
mhm,
Latinos, we feel left out of the marketing of this drug. We feel like, this was exciting new drug. It came on the market, PrEP, it can help prevent new HIV infections, and we weren't included in the ads and the conversation around it. And so that's one piece of it, but a huge piece of it too is around stigma. I mean, you're right.
mhm,
Education is key, but I've had some people tell me, I think you were talking more about like lower levels of education, like elementary, high school. No,
mhm,
they're
mhm,
saying doctors need
mhm,
requirements of education
mhm,
around PrEP. We need our doctors to know more. Some of the folks I interviewed for this story, one woman in particular shared with me, just some of the comments that she got from doctors or the lack of knowledge that, felt hurtful to her, felt stigmatizing to her when she was wanting to get on PrEP, something she considered, a very responsible thing to do. So there's that stigma piece to even in the healthcare space, which that did surprise me a little, I have to say.
Yeah, me as well. When you actually were talking about that one person that you interviewed, and they mentioned how many times they tried to, access PrEP, and they were sort of turned away by the medical community, the people who were treating them. And I'm not sure if it's because they have lack of familiarity with the usage of the medication. What a lot of doctors have a tendency to do is within their own specialty is to get used to a certain listing of medications. They learn how they react, how they sort of have side effects and what to look for and all those things. And they're kind of hesitant with using a new drug that they don't know much about. And it hasn't been part of their practice. But I think that's something that that needs to be part of the AMA NMA for them to push that doctors get CME on that particular issue, continuing medical education, because you have a certain amount of continuing medical education you have to do every year in order to maintain your licensure, to practice. This is an essential part of practicing, especially if you're a primary care physician, a pediatrician even, or, OB-GYN, right? That your gynecologist and obstetrician should know about this and start guiding their patients as well. But one of the other things that you were mentioning in the article is the cost, and there are new drugs that will come onto the market as research goes forward, and they start looking at the effectiveness of different drugs. This one seems to be highly effective. When you start talking about having a rate of prevention in that realm, there are not that many things out there that will do it. Vaccinations for measles, but this is by 99%. That I think we always use vaccinations for measles as the gold standard because it's high in the 90s. But this is 99%, and so this is something that I think needs to have more exposure. I'm glad you wrote the article talking about, giving people heads up on things like Nova and that kind of thing. People should be reading your article too. I really strongly
thank you.
advise people to read it. And, and I think the legislators and people who are legislative liaisons, health departments, should be looking at this information and making sure that their yearly plan incorporate some of the issues that you're putting in. I work with the Illinois Department of Public Health now, and they are really proactive on a lot of things that are going on. And so I always, I'm sort of hooked now on Kaiser Family Foundation Health News, and I'm looking at many of the articles, and they're so well written and really are bringing up salient issues that people need to be paying attention to. And the prep, I was looking at the amount of money that sometimes it costs. There was one person actually who was having problems getting the prep that you interviewed, and then she ended up going into a study, and now she's worried about, once the study is over, this is going to average the treatment for lenacapavir is going to be about 40 grand a year. And most people can't afford that. I'm going to put myself in that category for medication, where you have 40 grand a year going for, protecting your life.
Yeah, that's absolutely true. Just to kind of back up for a second too, you're right about doctors, not necessarily knowing about these drugs. I have a chart here, and these drugs can also be, used to treat HIV. So, okay, if you're, like you said, if you're just a run-of-the-mill busy doctor, you can understand that maybe they don't know the ins and outs of this. But like you said, there's a way to learn about it. And, as, this one woman I spoke to from my story was saying, to not have to experience the stigmatizing comments, that was probably one of the most upsetting parts for her. But then to kind of fast forward to what you're saying, there are a range of PrEP drugs. So there's different options for people. Like I said, there's a daily pill or 2 different forms of that on the market, and a drug injectable you can get every 2 months. And now there's an exciting new drug. A lot of people are really excited about it. It's been through a couple big clinical trials, well, big-ish. We can get more into the details there, that had really great results. Like you said, it's called lenacapavir. It's already been used for HIV treatment, but in these multi-site trials in men and women, very few people, just a few, had HIV. And to your point, I asked a doctor here about that. I said, now, is that because you only have to get this injection once every 6 months? So you're never going to forget to take your pill. Your base, as long as you show up once every 6 months, you kind of got very good, what they call adherence. Or is the drug actually better, at preventing HIV? Is it what they, so which one is it? And he said he thought it was, early days, but there's, probably some effect of both, but that adherence, only having to do it once every 6 months, is a huge part of the success, it seems. So, like you said, now there's some more trials ongoing on that, including one here in the United States, among cisgender women in particular. So that's exciting. Again, like you said, the drug has a kind of high list price, at least as it's currently being used for HIV treatment. So, again, it's already being used for that. And so what will happen to the prices of this, what people are calling blockbuster drug going forward? That's a whole conversation we can have, but that's the sort of big, high 10,000-foot view of what's going on with lenacapavir, if that's helpful.
Oh, yes, very helpful. Yes, yeah, great information, and a lot of great promise there. And then, the frequency of dosing, every 6 months is something that I think most people can adhere to. You can go to a routine doctor's visit, and have that administered in a primary care setting, and you're covered. So if we had a drug like that for many of the infectious diseases that we've had in the past, like polio and those kinds, we'd be.
What about even blood pressure? That's what someone said to me. I wish I had this for my blood pressure.
That's right. That's right.
Yeah.
Yeah, and one of the things is that sometimes, when I was practicing, we did, you potentially get needle sticks when you were working in hospital settings or in clinics. So we had post-exposure prophylaxis that came in, and there was a lot of stigma around it, and people didn't want to admit that they were stuck on a needle and those kinds of things. And in diabetic patients, they have to guard their needles because sometimes their family members, if they are IV drug users, will use their needles and put them back in there. And so, there's a potential for transmission of HIV that way. So we warned them about it. But there's a lot of situations where protection could be in place, correctional facilities, those kinds of things, with men having sex with men in prison systems before they are released and come back out. That they may have sexual relations with other men or with women. And that is a potential mechanism as well. So there's multiple situations that are out there where HIV is, and it's not ascribed to one particular person or one particular gender. It's a disease. It's something that can be transmitted from person to person, and we have to get that into our mind. The stigma has to go away in order to take care of it. But we're running out of time. They're giving me a flag. And every time I get into a really great conversation, it seems like these flags come up. But we have to have you back on, Rebecca. I'm going to be following your articles because this one was extremely well written. Again,